The World Health Organization says it will no longer use the term swine flu to refer to the current influenza outbreak. Instead, the new virus is being referred to as the H1N1 flu. The WHO has repeatedly stressed that people cannot be infected by this new virus through the consumption of well-cooked pork or exposure to pigs. The WHO's Assistant Director General for Health, Security and Environment, Keiji Fukuda, says even though the virus originated in pigs, it is not people are becoming infected by pigs. He says this is a virus being transmitted from person to person. The number of confirmed H1N1 flu cases around the world is continuing to rise. 12 countries have now reported confirmed cases of the H1N1 strain. Mexico, the most seriously affected country, has reported at least 176 deaths based on symptoms and initial tests. So far, there are 12 confirmed H1N1 flu deaths in the country, and 270 people there are confirmed to have been infected. The U.S. has reported 109 confirmed cases with 1 death. Canada has at least 27 confirmed cases. In Europe, there are 13 confirmed cases in Spain, 8 in Britain, and 3 in Germany, and 1 in Austria. In other regions, New Zealand has confirmed 16 cases, while Israel has 2. Netherlands, Switzerland, and Peru has also confirmed their first cases Thursday. Suspected cases have been reported in at least 16 other countries, including Australia, France, Guatemala, South Africa, South Korea, and Japan. The World Health Organization on Thursday confirmed a total of 257 human infections. The WHO said it would update its tally as the situation evolves. Mexico's Health Minister Jose Angel Cordova praised the measures taken by his government to prevent the spread of H1N1 flu virus, saying they had kept the situation under control.
Mexico
has been able to take a series of appropriate measures to minimize the progression of the virus. These have allowed us to maintain the situation at a controlled level. We are working actively with the health authorities of different countries, especially those of the United States and Canada, and also with international health organizations, principally the World Health Organization. The result, it is clear that it is not just a problem, but a global problem.
And here in China, the country has provided emergency humanitarian assistance to the Mexican government to help it deal with the epidemic. A flight carrying the first batch of aid left Beijing on Thursday evening. Zhou Jun has the story.
China had a painful experience dealing with the SARS outbreak in 2003. Now it's helping Mexico fight the deadly H1N1 flu. The Ministry of Commerce has announced it will give Mexico $5 million in emergency humanitarian assistance. That includes $1 million cash and $4 million in aid. The money was sent to Mexico on Wednesday, and a 50-ton batch of materials in 4,500 boxes left Beijing for Mexico in a chartered plane on Thursday evening.
The first batch of materials sent to Mexico are the most needed items. They include masks, gloves, isolated cloth, disinfectant, and body temperature scanners.
The plane is scheduled to arrive in Mexico on Friday at noon. A second batch of materials will be sent to the country on Saturday. Zhou Jun, CCTV.
Nearly 300 schools scattered across the United States closed as the country's H1N1 flu caseload surpassed 100 on Thursday. U.S. authorities have pledged to produce enough vaccine for everyone. The Fort Worth Independent School District in Texas will close its 140 schools, affecting about 80,000 students. Sports activities at high schools in Texas and Alabama were also suspended. Meanwhile, the nation is taking extraordinary precautions, including shipping millions of doses of anti-flu drugs to states. EU health ministers meeting in Luxembourg have rejected a French idea to ban flights to Mexico, saying it would not stem the spread of the H1N1 flu virus. Instead, they agreed on coordinated action, especially to develop a vaccine as quickly as possible. Yang Wei-han has more.
At an emergency meeting on Thursday, the ministers discussed a French proposal to stop people from traveling to countries affected with the H1N1 virus. They said a travel ban to Mexico is not necessary, but insisted they must coordinate their response, share information, and develop the vaccine together.
What we will do is better coordinate information amongst ourselves, which means finding out about cases in member states, but also to find out the profile of the patients, which is important information. We'll also ask more precise information on transmission and more specifically relating to travel precautions. Piloting the vaccine at the European level once we discover it, and finally a coordination platform for antivirals.
EU officials say they are well prepared to deal with the H1N1 flu virus and there is no need to panic. Denmark has already bought extra doses of antiviral drugs and will distribute them to other states should they need them. Some countries, like Spain, have the pharmacies from selling antivirals to ensure they have enough stock to cope with an outbreak of the virus. Yang Weihan, CCTV.
China's Ministry of Railways has released its prevention measures to fend off the H1N1 influenza pandemic. The measures focus on suspected H1N1 patients and people who may have come in contact with H1N1 patients. The guidelines say that the particular attention should be given to customers who come off from the virus-hit countries and regions. The Ministry of Railways has also strengthened cooperation on nationwide prevention. Meanwhile, the Ministry of Transport is also urging related sectors to increase measures to fight against H1N1 virus. Vehicles and vessels to the countries confirmed or suspected to have the virus should be sterilized, controlled, and monitored. China's Health Minister Chen Zhu says the country has developed an effective method to instantly diagnose any possible H1N1 influenza cases. Meanwhile, some experts say a new vaccine could be produced in the middle of August this year. Amy Benbridge has the story.
As soon as China received the World Health Organization warning about the threat of an outbreak of H1N1 influenza, work began on an effective method for quick detection. Health Minister Chen Zhu says a new diagnosis method has now been developed.
Through the joint efforts of experts and scientists from the Chinese Center for Disease Control and Prevention, or CDC, and the Chinese Academy of Medical Sciences, a new method for the diagnosis of H1N1 influenza has been developed. It will be provided to local CDC offices as soon as possible.
The minister also revealed that the government has mandated an increase in the production of Tamiflu and other antivirals to cope with possible human cases of H1N1 flu or its variants. Chen Zhu also says China has asked the WHO and some disease-hit countries to get the virus strain of the variant H1N1, which is crucial to ongoing vaccine research. With experience fighting SARS and bird flu, China has the technology to produce appropriate vaccines. It's expected that an H1N1 vaccine will be developed faster than those for SARS and bird flu. It's predicted that the new vaccine to counter the H1N1 virus will be produced in 3 months. Although all three viruses are transmitted through the respiratory system, H1N1 is not likely to have the same impact.
The intensity of H1N1 influenza will be bigger than that of SARS and bird flu, but the fatality rate is relatively lower.
The Health Ministry has issued and distributed a guideline to diagnose H1N1 and its variants to health departments nationwide. It mandates local authorities to train medical personnel as soon as possible. It also stresses the virus is susceptible to heat and could be killed if it's exposed to temperatures over 56 degrees Celsius for half an hour. Amy Bainbridge, CCTV.